Great.
Perfect. All set to go.
Okie dokie.
All right. Welcome in, everyone, to another Great Lakes ROTA-R presentation. Today's event is Survey Says, Leveraging School Community Partnerships to Promote Student Wellbeing. Before we welcome our presenter in, we're going to go through a few of our quick housekeeping items. My name is Amanda Kerr. I'm the Regional Project Manager for the grant, and I'm glad to see all of you here today. I want to just go ahead and acknowledge our funder, SAMHSA. We are a training and technical assistance grant program through SAMHSA. We cover Region 5 of Health and Human Services. The states are indicated there along with our website. If you are interested in our website, and we hope that you are, you'll go and check us out. We do have a number of resources, although there's been an update to some of the resources that we provide. You can go ahead and move forward, Lauren. Essentially what we provide are virtual education, community toolkits and resources. You can access our newsletter, as well as get up-to-date information and news regarding substance use and mental health happening within our region and across the nation. So we encourage you to check that out. Speaking of our newsletter, we have a brief kind of view of our newsletter platform. You can go in and see our archived newsletters, and you can get signed up to receive them. We do two newsletters a month, one that kind of covers more broadly the overall region, and a second shorter one that discusses upcoming training. So if you want to make sure to get highlighted on what's coming up next, then please sign up with us. Lastly, I just want to kind of talk about words and how they matter, particularly in the context of the events that we host here through ROTA-RC. So we want to make sure that we're using person-affirming, first-person language when discussing behavioral health disorders. We want to create an environment that's non-stigmatizing and recovery-oriented to help reduce that negative bias and promote successful engagement. With that being said, again, I want to welcome you all into our virtual learning community, and we're happy to have you here and to have your participation. I'd like to move now to introduce our presenter. Lauren Doyle is someone we're very proud of. She's one of our teammates here at Great Lakes ROTA Technical Center. She's been an integral part of our grant for the last year and a half almost, I think. Lauren is a project assistant for our grant, and she's a graduate student at the Sandra Rosenbaum School of Social Work here in UW-Madison. She's very passionate about creating supportive environments in schools, and she will be moving on post-graduation to work full-time as a school social worker in Michigan. With that, I'm going to hand it over to Lauren.
Wonderful. Thank you so much, Amanda. I'm just going to make sure all my technology is situated here before we get into it. And jump into our agenda. So thank you all for joining us today, whether it's morning or afternoon where you're from. Thank you. And as Amanda said, my name is Lauren. I am currently a project assistant, and I am a master's social work student focusing on school social work. So in my time with ROTA, I have worked with data from the Youth Risk Behavior Survey, read through the 10-year trend report and saw lots of intersections between what that report was sharing, what it was suggesting for supporting our students moving forward. And a lot of it had to do with supports in schools. So I thought it was kind of a interesting connection for me as a school social worker. And I thought it's an important topic to kind of cover that intersection. So today we are going to start with talking about the Youth Risk Behavior Surveillance System.
Lauren, can I pause you real quick? It looks like there's some audio issues. I just want to check on that so people aren't missing out. It looked like a couple people. Can you indicate? Nope, that's all right. Can people indicate if they're having trouble hearing Lauren? Okay.
Maybe if Lauren can speak louder, because she doesn't have a mic.
Oh, okay. Yes, I can speak louder. Sorry about that. Is this better?
Perfect.
for
Thanks,
everyone.
Lauren.
Okay, apologies. Thank you, everyone. So all that to say, this is our agenda today. We're going to talk about the youth risk behavior surveillance system. So we're going to get into the 10-year trend report that covers data from 2013 to 2023. We're going to talk about trends in the Midwest region. And then we're also going to talk about what are the CDC's recommended school-based strategies based on the data that we've looked at. What are the implications of those strategies for school systems? And then some suggestions for school community partnerships as a way to for different areas to integrate these CDC strategies. So again, to reiterate, today's presentation outcomes are understanding the general trends in youth health and well-being in the region, interrogating the implications of proposed CDC solutions for schools, and encouraging engagement between schools and community partners to benefit all children. So the youth risk behavior surveillance system, which is a very long name, is really just a set of surveys that measures health-related behaviors and experiences that can lead to death and disability among youth and adults. So again, the system in the YRBSS acronym just means a system of surveys. So there's a national survey called the Youth Risk Behavior Survey, conducted by the CDC, that includes high school students from both private and public schools within the US. And then there are surveys conducted by departments of health and education at the state, tribal, territorial, or local levels of their respective public high school students. And the Youth Risk Behavior Surveillance System was designed to determine how often unhealthy behaviors are occurring, assess whether unhealthy behaviors increase, decrease, or stay the same over time, which is something we're going to look at today, provide data at the national, state, territorial, and freely associated state, tribal, and local levels, provide data comparing different groups of adolescents, and also monitor progress toward achieving the Healthy People objectives and other program goals. So the YRBSS is important because the results help monitor adolescent health behavior changes over time, identify emerging issues, and plan and evaluate programs to support the health of youth. So some of the data collected and data that we'll be looking at today are student demographics, including sex, sexual identity, race and ethnicity and grade, youth health behaviors and conditions, so including sexual behavior, injury and violence, bullying, diet and physical activity, obesity, and mental health, including suicide, substance use behaviors, including electronic vapor product and tobacco product use, alcohol use, and other drug use, and even student experiences, including parental monitoring, school connectedness, unstable housing, and exposure to community violence. And this is a good point to also, I always like to give some kind of trigger warning for the data that we'll be looking at will include discussion of suicidal ideation and sexual violence. The indicators will discuss that. So I just like to preface that and say, please take the time that you need, turn off your camera, take a break, get a snack if needed. So this is a map of the different high school participation in the 2023 Youth Risk Behavior Survey. We're going to take a little bit of a dive into sampling right now. So if data is your thing, maybe you're excited. If not, I appreciate you being here with us. So in 2023, they finally switched over to trying to distribute the survey entirely on a tablet. So a tablet-based electronic survey rather than paper copies. So the National Youth Risk Behavior Survey is conducted biennially in the spring months, so typically January through June of odd-numbered years, and it's conducted among 9th to 12th graders in public and private schools. In 2023, it was an 107-question survey. There were 87 questions in the standard questionnaire, and then the CDC added 20 questions sort of based on emerging areas of concern and other program interests. So the sampling frame for the national survey includes public schools, charter schools, parochial schools, and private schools with students in at least one of 9th through 12th grade. And the frame excludes alternative schools, special education schools, schools operated by the Department of Defense or the Bureau of Indian Education, and vocational schools. And the frame was constructed from market data retrieval and the National Center for Education Statistics. And the way that they developed their sample was through a three-stage process. So stage one, they identified 1,257 counties or groups of small adjacent counties or parts of large counties. And they considered that their primary sampling unit. Then they organized this primary sampling unit into 16 groups or stratas according to the metropolitan statistical area status of that county, so urban, suburban, rural. And also they organized them by the percentage of Black and Hispanic / Latino students per primary sampling unit. So ultimately, 60 of those primary sampling units were sampled with probability that's proportional to the school enrollment for the primary sampling unit. I promise this is the most like sampling and data we will talk about before getting to the numbers. So the second stage is that from those 60 proportional sampling units, they took 180 secondary sampling, they selected 180 secondary sampling units. So those were physical schools with 9th through 12th grade, or a school that they kind of created by combining nearby data on like a 9th and 10th grade and 11th and 12th grade. So an additional 20 secondary units were selected from that subsample of the 60 proportional units. Ultimately, that led to 204 physical schools. And then when they're distributing the actual survey, they just do random sampling of 1 to 2 classrooms in each grade from either a required subject or a required period. All students can participate, but schools, classes, and students who refuse participation were not replaced in the sample. And another important development for 2023, the 2023 survey, was that they included a supplemental sample for the group that they describe as American Indian / Alaskan Native. So they again used a 3-stage cluster design. They used that same first sampling frame of over 1,200 counties. They selected 55 secondary units to sample that have proportional probability to aggregate American Indian / Alaskan Native school enrollment, which led to 114 physical schools. All of this to say, over 20,000 questionnaires, 20,386 to be exact, were completed in 155 schools to make up the data for the National Youth Risk Behavior Survey. For the site level surveys, those are conducted among students in grades. So when I say site level, I mean the state data. Those were conducted among students in grades 9 through 12 attending public schools by using samples that were representative of the state, tribal, territorial, or local jurisdiction where they were administered. So 68 sites administered a youth risk behavior survey in 2023 that included 39 states, 3 tribal governments, 5 territories, and 21 local school districts. And as you can see on the map that is on the slide in front of you, 36 of those states, the 3 tribal governments, 5 territories, and 21 districts had representative data for 2023. So the 3 gray states participated in the survey, but did not have representative data. And as you can see also for the Midwest region, Minnesota does not participate in the Youth Risk Behavior Survey, but they do have their own state survey. That's the Minnesota Student Survey, and will be, however imperfectly, comparing their data to the Youth Risk Behavior Survey as well to have them included in the conversation. Ultimately, it's very similar to the national survey, but the state survey has 87 questions, and sites can add or delete questions, but they have to use 58 of those 87. So you'll kind of see that too when we're looking at the data. Some of the states have no data reported for certain indicators, and it could be for a variety of reasons, one of those being that they may not have chosen to include that question on their survey. Ultimately, they used a similar sampling process for 37 states, 1 tribe, 1 territory, and 4 districts. Public schools with any grades 9 through 12 were sampled with probability proportional to school enrollment size. And then 2 states, 2 tribes, 4 territories, and 17 school districts all schools were selected to survey. And then they use the same process surveying intact classes from a required subject or period. So if students were selected for both samples somehow, they were asked to participate in one. So that's my brief background on the sampling process, just so we can kind of have a greater understanding of what we're looking at when we're looking at data. So a big part of this was also reading the 10-year trend report on the YRBS that the CDC put together. And from reading that, I decided to organize this presentation in these categories. And these categories mostly align with the focus areas in the 10-year report. So mental health, experiencing violence, sexual behavior, substance use, and new and emerging data. And then I kind of cobbled together the physical health section, which intersects with all the previously mentioned categories, but it kind of focuses on nutrition, physical injury, sleep patterns, etc. So we're going to look at 2023 Youth Risk Behavior Survey data, as well as additional trends that are highlighted in the 10-year report. So the first topic area we're going to look at is substance use. So first, I'll explain what we're looking at. We have a table that has the national YRBS data in that highlighted red area. And then we have each state in the region's data point. The arrows that I have included are indicative of, is this an improving trend over 10 years or a worsening trend over 10 years? And the color of the arrow is also either green or red, and the green indicates an improving trend. The red indicates a worsening trend. So for current alcohol consumption, first of all, currently, for anyone that's unfamiliar, means participated in the last 30 days before the survey was administered. The national trend is, it's an improving trend. So the rate of students reporting that they're currently consuming alcohol is decreasing. For current marijuana use, the trend is improving because the rate of students reporting using marijuana currently is decreasing. And then similarly for current use of electronic vapor products. And then from whatever state that you are joining in on, I encourage you to look at your state and how they compare to that national rate. And something that I also like to think about when I'm looking at these data points, we can get into a cycle of, wonderful, we're lower than the national average, or oh, we have some places to work because we're higher than the national average. I also encourage everyone to question, should our national average even be as high as they are for some of these data points, or is it concerning that our national average is as high as it is, right? But overall, we are seeing improving trends in youth reporting substance use. We're seeing a decrease in that substance use behavior for these three areas. Now we have mental health. So this is an area that is generally concerning. You'll see some of these cells include no data. That just means, again, like I was mentioning before, state data may not be available due to many things. Maybe the state opted not to include that question. Maybe the results were in such a way that they could not be included. So like the number of respondents within the subgroup did not meet the minimum reporting threshold. And again, when we're comparing Minnesota's rates to other states, it's important to keep in mind that they did complete a different survey. So if Minnesota looks like an outlier, that could be an element that is making it look different compared to the other states. So for this first category, this concerns me as a school social worker, right? That only half of our students strongly agree nationally that they feel close to people at their school. That means that almost half of our students feel either neutral, disagree, or strongly disagree that they feel close to people at school. And for anyone that works with youth or works in schools, you likely know that one of the most important predictors of academic success, of graduation completion, is feeling like you have at least one adult in that setting that is invested in your success. So that's a concerning data point for how high it is. And also we're seeing a worsening trend in that indicator, which is concerning. Over 10 years, we saw that there was little change actually in the number of students that reported that their mental health was most of the time or always not good. I think still over a quarter of our students reporting that is a concerning rate of students. And you'll see for some of these mental health indicators, for some of our states, we are quite a few points higher than these national averages, which may or may not align with maybe your experience in the field. For feeling sad or hopeless, this is a worsening trend as well, because the rates of students reporting that they're feeling sad or hopeless for 2 weeks at a time within the last year is increasing. And it's also over a third of students that report this. In this case, the Minnesota number is quite different. And I want to point out that for their question, they asked about within the last 2 weeks. So not like the other states answered a question that was asking about 2 weeks within the last 12 months, right? So that could account potentially for that difference. And we see similar concerning trends with suicidal ideation and suicidal behavior as well, that those trends are worsening and more students are reporting attempting. And then also it's kind of mixed between, you know, again, look at your state and compare to your experience. But for example, for seriously considered attempting suicide, Indiana is at 25% versus that national average of 20%. So differences like that are pretty stark, as well as with actually attempted suicide. They are higher than the national average. So now moving on to experiencing violence. And with all of these, I do want to make it clear there are so many more indicators. I chose indicators kind of based on what I felt was the relevance to my work in schools, but I encourage anyone, the links are on each slide, to go through this data. It's publicly available and it's pretty intuitive on the CDC website, and find indicators that relate directly to your work or that you're interested in. So we're seeing some positive improving trends in experiencing violence. For example, being in a physical fight, we're seeing the rates of that are lower. And for the states that are reported in our region, the rates of being in a fight are lower than the national average. And we're also seeing a decrease in experiencing sexual dating violence or reporting of experiencing sexual dating violence among youth. However, we are seeing a worsening trend. So we're seeing more students reporting that they are seeing violence in their neighborhoods. I believe this data point also kind of significantly jumped after 2019, which is interesting given the global events that were occurring in 2020 and onward. So that trend is worsening, and that's almost a quarter of students are witnessing violence in their communities, which really affects one's self of safety and the behavior that they're seeing being modeled in their communities, right? And then also the reports of students experiencing sexual violence by anyone have increased, which is kind of interesting given that sexual dating violence, there's an improving trend in that. I also want to point out for the Minnesota data point on experiencing sexual dating violence that Minnesota's question is much more descriptive than the YRBS question and there's pros and cons to making your questions more descriptive on surveys, right? But their question is, have you been in a casual or serious relationship where your partner ever pressured, tricked, or forced you to do something or did something to you against your wishes? That's much more descriptive than the YRBS question. So I think that can influence responses as well. And it's something to think about with the way that you think about, like, what is a casual relationship versus a serious relationship, and will that impact the way they answer the survey and the way that we get our data? And then we have the experienced physical dating violence. That trend stayed relatively consistent over 10 years, so kind of hovering around that 10%. We've got two more categories. So this one is sexual behaviors. So we're seeing overall a decrease in students reporting sexual behavior at all, but we are also seeing a decrease in protective behaviors related to sexual behavior. So the rate of students reporting that they're using a condom during last sexual intercourse, that rate is decreasing, which is a worsening trend. For a lot of these sexual behavior indicators, I find often that the region is at or below the national average. But you can see here, like Minnesota, Illinois, Wisconsin report being higher than the national average for that protective behavior example. Also, the rate of students reporting that they drank alcohol or used drugs before last sexual intercourse, that is actually an improving trend because the number of students reporting that are decreasing because that's an unsafe sexual behavior. And other than Illinois, the region is consistently lower than the national average. And then additionally, there's a worsening trend in students reporting that they are being tested for an STD, ever being tested for an STD other than HIV. I think there's probably many things that go into it, and all of you public health individuals that are out there watching this presentation can probably think of a couple of reasons or more complex reasons better than I can that would explain this data point. I suspect that a lower rate of students reporting sexual activity at all has something to do with it, but it is concerning still that those that are sexually active there's a worsening trend in them seeking out that care, right, to make sure that they're being safe. And then finally, we have physical health. So I compiled a few different indicators here. And all of the trends in physical health are worsening, whether it's an increase in reports of a certain behavior or a decrease in reports of certain behavior. So, some of these were stark to me. So, not eating vegetables within the 7 days prior to the survey. 6.8% of students surveyed in the national survey said that they did not eat vegetables in the 7 days before. And that's a worsening trend. That trend is increasing. And we also see our region is either very close to that average or above. Additionally, only around a quarter of our students are saying that they have breakfast every day on the 7 days before the national survey. So I think that's a concerning trend given what we know about academic success and nutrition and just development and nutrition. Also, only a quarter of our students generally are getting 8 hours or more of sleep every night, and that trend is worsening. Anyone who is working in schools or with youth probably knows that starting very young, they're staying up very late, oftentimes on screens. So I suspect maybe that has something to do with the worsening trend, but that's definitely a concern. We're seeing an increase, so a worsening trend in students who are identified as having obesity. And it's kind of variable across the region, but with Ohio being the highest at 19.8%. And then we are also seeing a worsening trend in students reporting being physically active for at least an hour a day throughout the week. While this might sound like a lot of exercise to us potentially, that is what the CDC recommends as a healthy amount of exercise for our young people. So we're seeing a worsening trend, less students reporting that they're active for an hour every day, with Minnesota being significantly lower. Again, that might be based on their sample, the differences in the surveys. But all in all, the rest of the region sits at about a quarter of students there. So overall, I just threw a lot of data at you. Overall, from 2013 to 2023, we are seeing improving trends in sexual risk behaviors in general. So we are seeing a decrease in students reporting that they have ever been sexually active or that they are currently sexually active. And we're seeing a decrease in students saying that they are having 4 or more lifetime partners. We're also seeing a decrease in substance use. So we're seeing a decrease in illicit drug use, a decrease in reporting of prescription drug misuse, and a decrease in that current alcohol and or current marijuana use. However, we're seeing worsening trends in protective sexual behaviors. So like the condom use, like we saw before. We're also seeing worsening trends in people experiencing violence, including sexual violence. And we are seeing worsening trends in that mental health area with persistent sadness and or hopelessness, experiencing that, and also experiencing suicidal thoughts and behaviors, which I do think is interesting. And I don't think I have enough depth of knowledge to go deeply into this, but I find it interesting that, you know, we are seeing improving trends of substance use, so decreasing rates, but then we're seeing these worsening trends in mental health, because as anyone that works in a mental health area knows, there are those connections between you know, negative life experiences, experiences of trauma, mental health, and substance use. So I find it interesting that we're seeing a decreasing rate of substance use while there's an increase in those negative mental health symptoms and experiences. So there's also some national trends on new and emerging data that are interesting, that focuses on, and so they pick like 3 new categories in each youth risk behavior survey to experiment with emerging trends that the CDC is seeing from youth, right? So in the 2023 survey, there was social media use, racism in school, and unfair discipline. So they found that 77% of students report using social media several times a day. Again, those of us that work directly with youth every day, 77% is not a shocking number given how available their phones are. But that's a lot of time, and we don't have great indicators for what that use of social media looks like and how unrestricted it is, or if it's positive or harmful, right? In terms of racism in school, almost 1/3 of our students are reporting experiencing racism in school. And then we also see that almost 1/5 of our students are self-reporting experiencing unfair discipline in school as well. And all of these categories are not without an impact on these students, right? So increased social media use can also increase the prevalence, or is related to a prevalence of being bullied, prevalence of feelings of sadness and hopelessness, and suicide risk. Racism, experiences of racism in school have been associated with prevalence of poor mental health, prevalence of suicide risk, and substance use as well. And then unfair discipline in school has been shown as well to relate to prevalence of poor mental health, persistent sadness and hopelessness, suicidal thoughts and behaviors, and other health risk behaviors. So these are definitely areas of concern. So what did the CDC have to say in terms of addressing these concerns? We've looked at all this data, and now we're wondering, what do they have to say? So they said in their 10-year trend report, schools play a large role in youth's lives and development. Partnering with and supporting schools has the potential to reach large numbers of young people with strategies that can make a positive impact. So the CDC identifies that partnering with schools is essential in addressing mental health and risky behaviors. And I think this may ring true, especially for those that are working maybe in rural areas where there's a limited number of geographically spread community organizations for youth. A school being present in your community can be a really powerful place and opportunity to provide a variety of services and in a central location, right? So the CDC proposed 3 specific school-based recommendations in their 10-year trend report based on the data that we have looked at. They suggested promoting mental health in schools, ensuring quality health education, access to needed services, and safe and supportive learning environments. And they suggested increasing connectedness for young people, all of which I agree with. And I agree that schools can be a fruitful access point to providing resources and supports. But I also think that we should be very intentional about how we integrate services into educational settings, understanding that schools have limited capacity for these things, right? And their primary domain is education. However, us working in schools, we know that mental health and the well-being of our students is central to them receiving education. So I read these recommendations with enthusiasm that schools are being centered in this conversation, and also just concern that we understand the importance of promoting the mental health of young people, and also schools just can't carry that challenge alone. And I don't think it's ethical for schools to carry that challenge alone, given that a lot of the day is dedicated to education, right? Not providing health services. So what is the solution to that is school community partnership in my mind. I think some of the beauty of school community partnerships are that they're based in the community being served, right? So they're of the community for the community. A lot of times you can utilize existing resources and spaces and kind of optimize those resources and spaces. And then also in the process, you bring together multiple stakeholders that bring their different skills and different perspectives to the room. And oftentimes you can come up with innovative solutions with those different skills and perspectives being present. So the promise of school community partnerships is that there's evidence, there's different studies that show that these partnerships have very positive outcomes for students. So the partnerships have been shown to improve social emotional skill development for students. They've improved student engagement via the indicators of attendance rates and chronic absenteeism. And they have also improved academic outcomes through the indicators of test scores, grades, on-time grade promotion, graduation rates, and specifically school-based mental health services that can be provided or supplemented through a school community partnership have been shown to improve physical and psychological safety of students, academic performance of students, and social emotional competence. They've also been shown to reduce disciplinary referrals, dropout rates, substance misuse, and criminal justice involvement. So there is evidence to suggest that these partnerships, when promoted effectively, can have a really positive impact on a lot of the issues that we just saw are spiking in the data, right? So I like to use the school community mental health framework as a good example of this. And depending on what your school and your community look like, partnership is going to differ. I think it's really important for you all to take in the information that I'm saying, but apply it to your community, change it, twist it, however you need to. So first, I'm going to go through a couple types of partnerships. There's agency collaborations, full service schools, and community schools. So agency collaborations are where a school collaborates with one or more agency to provide students and families with like either health and social services, or collaborate with a community-based or national nonprofit to offer students academic enrichment. So that's kind of a more siloed approach. You have one or two program collaborations. Then there's full service schools, and that's where a school partners with several organizations and agencies to offer a variety of social, health, and academic enrichment services to students, families, and community members. And the school is the hub of these services and activities. Then finally, you have community schools. So a community school is a school that basically makes the same type of partnerships as a full service school, but they also ensure that those partner organizations, parents and families, and community members can participate in the school and partnership planning and decision making. So it's a more integrated approach, even more so than full service schools. So I think mental health is an area that a lot of districts are realizing they either need or would significantly benefit from at least agency collaboration, right? Like given the 8 hours of the school day, schools are realizing we can have a social worker, a counselor, and a school psych, and we can only reach so many students. So we need to collaborate with others. I think that we can conceptualize this collaboration by utilizing a framework that's common in education spaces, which is referred to as multi-tiered systems of supports. So often we hear MTSS, which is the acronym, describing behavioral intervention and academic intervention. But I think it's a great model to describe how schools and mental health agencies can collaborate to meet student needs. Sorry about that. I'm very familiar with the school district pyramid that you see on the right, where the tier where most students receive services is tier 1, the universal services and supports. Then tier 2 is like a select group of students that maybe might receive a group mental health curriculum, some other sort of lower effort intervention. And then tier 3 is kind of your highest intervention, highest needs students. And school districts have kind of the most bandwidth to work with that universal area. And then they have the least bandwidth to work in the most intensive kind of supports. Then on the flip side, community partners can supplement well, because their ability to reach an entire group, right, an entire classroom is more limited than a school where you have those kids in the classroom every day. I think we share kind of a similar level of an ability to reach smaller groups of individuals that need certain services. And then community partners can really give the time and the care needed to those students that are tier 3 in schools, to provide like the intensive mental health care, maybe like day treatment type services that are needed for students. So for me, when I saw this pyramid inverted to describe the way that community partners can work with schools, it was really helpful in visualizing how we're partners in this collaboration to provide students with what they need. Because I think often schools are concerned that our caseloads of students that need higher support are just continuing to grow. And without greater investment in schools, we can only expand our capacity so much. So ultimately, I think that school community partnerships can broaden the supports that are available to students and enhance access to mental health care, which is related to a lot of the concerning data points that we reviewed earlier in the presentation. And then finally, I wanted to highlight some examples from the region of what this partnership can look like in different ways. So first, if you were present for the last ROTA presentation for Growing Through Grief was highlighted. It's sort of based in Minnesota, but serves different sites in Minnesota and Wisconsin. I think this is a good example of agency collaboration where I believe it's a healthcare provider sort of has partnered with different schools to provide in-school support for elementary, middle, and high school students coping with the death of a loved one. They also provide crisis services for school communities that experience a crisis. So maybe a death of a teacher, a death of a student, another traumatic event. They provide those crisis services. And over 84% of participants in Growing Through Grief have said that the program improved their coping skills. 97% said the program improved their knowledge of grief. and 100% would refer a friend to this program. So we do grief work with students in schools, school social workers and school counselors and school psychs. But again, our capacity is limited. We only have so much time in the day. And for those more intensive students who just need more of that support, this collaboration could really benefit those students. Another example of a collaboration that kind of mirrors one partnership and what a full school service model can look like is St. Clair County's Community Mental Health in Michigan. So this is a government health agency, and it offers services in 3 schools through a partnership between the St. Clair Community Mental Health, which provides therapy services, and the St. Clair County Health Department that provides nurses. They also have a teen health center that they've developed, which I thought was an incredibly cool concept, that is staffed with social workers and public health professionals, and it's housed in the Port Huron School District. And that teen health center has been running for 30 years, which is really cool. And they're also this summer looking to launch, they will be launching a teen advisory group with representation from students across St. Clair County. So I think this is a really great example of how an outside agency offered services to meet the different needs of students. And I think I like, mental health is this model that I think more and more people in schools have been looking at, but I think this public health model through like their teen health center is also positive to target some of those concerns that we're seeing with the decrease in students utilizing protective sexual health behaviors, right? And then finally, we have the Sun Prairie Community Schools that utilizes the community school model in Wisconsin. So this was launched in 2010. And it started with a community needs assessment. So a community member brought up a concern that there weren't enough opportunities for youth in the area to participate in positive recreational activities. So they started with a community needs assessment, the city did, around the idea of creating a Sun Prairie Boys and Girls Club. It just didn't work out for the city to collaborate with the Boys and Girls Club. So they're members of the Sun Prairie Youth and Family Commission were looking to collaborate with some community organization, and they got connected with the YMCA of Dane County. And so through working with the YMCA, they were introduced to the community schools framework and recognized that it met the issues that they were seeing in their community. And so the Youth and Family Commission of the city of Sun Prairie eventually partnered with the YMCA to get their community schools model up and running. And in this way, the Sun Prairie schools, the public schools, are the hub of their neighborhoods, and the city and the school district directly collaborate, as well as integrate community organizations into their collaboration. So again, these collaborations are similar and there are overlaps, but kind of just the approach to them and the model which they follow can differ. So I encourage everyone here today, look at what is available in your communities if you haven't already. I know this is integrated into a lot of public health practice and social work practice, so you've likely already done this, but I always think it's beneficial to do a needs assessment on your organization, whether it's a school or an agency, and create a resource map of your community. Even if you've done one before, you may find strengths that you didn't previously know. And I think just like agencies, schools differ. And so I just want people to understand that some schools may have a lot of capacity to do these kinds of needs assessments and create these resource maps, and other schools don't have that capacity. And that's also something that collaboration can support, is if your schools in your area have the opportunity to partner with you and serve students, but they just lack capacity to go through some of the processes that are necessary to set up a program, that's another place in which a partner can provide guidance and support and additional personnel to make those things happen. So ultimately, that is what I have for you today. I figured we'd save some time for any questions or discussion. And I hope that you take something from this presentation and it sparks you to think about an issue in your community and think about what collaborations you're already participating in or potential collaborations that you could engage in. And if you go back through the slides at any point, I've added links to all of the sources, and those links have further links that have guides to how to optimize community partnership and different resources. So I encourage you to check those out if you are inspired to engage in a community partnership moving forward. Thank you.
Thank you, Lauren. If anyone has any questions for Lauren, please feel free to unmute and ask or pop them in the chat, and we'll filter those to Lauren. While we're waiting for people to get their questions together, Lauren, if you want to just forward, we'll put the survey evaluation link in the chat. So that you can give us some feedback. We appreciate if you could at least take a few moments to fill out the first 5 questions. It helps us be able to feedback to our presenter and to let us know what kind of education you're looking for in the future. If you can get all the way through, that's even better. It shouldn't take too long. As far as the content from today's session, it will be available within a few days after today. Will be up on our website, and we do always send it to those who participated and registered for today's event. If you would like a certificate of attendance, those are available. Again, we will send those out automatically to everyone who participated today. But if for some reason that you don't receive it, feel free to give us a contact. Moving forward, all of our contact details are listed there on the screen. Thank you, Lauren. You can get a hold of us by email, contact our website, sign up for our newsletter, and you can find us on Facebook and friend us. Although we've not been quite as active on that lately, we still do have a presence there. And then lastly, as far as upcoming events, we are working on our summer calendar diligently. We will have that available as soon as possible. We got some fun things that we're looking forward to as far as great presenters. And in line with that, we also want to highlight for our Wisconsin colleagues who are working in substance use and mental health, the opioids, trauma and substance use summit is starting next week. I know that's a pretty big event, pretty popular. So if you're not signed up, make sure that you are. It's a great place to connect and get lots of resources. With that, I'm going to stop chatting. I'm going to stop recording, and we'll open it up for those who have questions.